Welcome to Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay happy and healthy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hey everyone, thanks for joining us again. Today we're talking about a really important topic for parents, and that is substance use that sometimes can turn into addiction. You may remember that we actually had a podcast not too long ago talking about vaping use in kids. So if you haven't checked that one out, I would highly recommend you listen to that one as well. As always, as we dive into this very important topic, let's listen to a question from one of our parents.
Hi, I'm Melissa. I hear other parents say they'd rather let their teens drink at home so they can keep it safe. I don't think teens should be drinking at all, but they tell me I'm being unrealistic. What do you think?
Thanks, Melissa. That's a really great question, and I think it's a challenge that many of us have been struggling with for a very long time. Well, you're in luck because today we are talking with Dr. Sharon Levy. She is chief of the Addiction Medicine Division at Boston Children's Hospital. Welcome, Dr. Levy.
Thank you for having me.
Thanks for coming today and talking about this important topic. I have two teens now, 13 and 15, so this is a topic that's looming on my head and my brain all the time. I want to make sure we get to know you a little bit. How did you get into the field of addiction medicine?
Yeah, that's a question that I get asked a lot. When I was in medical school, I decided that I would become a pediatrician, and there's so much good work that can be done with kids. An opportunity became available to start a substance use disorders program for young people. It was the first such program at a pediatric academic medical center. Yeah. And, I didn't know a lot about addiction when we were just getting started, but it presented such an important and interesting opportunity. And over time, it's really grown.
It's exciting to hear that Boston Children's had the first addiction medicine program right in pediatrics. And now my understanding is, hopefully other children's hospitals have followed suit.
I think pediatric addiction medicine is a growing field. So we're seeing programs spring up at lots of hospitals across the country, which is great news because there's so much work to be done.
Wow. Well, having said that, obviously, it's not work that we wish we had to be done, right? We want all of our kids to be healthy, but we know that addiction happens within our teens. I'm curious if you could tell me sort of just how common is the use of drugs, alcohol, and other substances in our adolescence?
Trying substances is pretty common. By the time kids graduate high school, about 75% of them will tell us that they've tried alcohol, marijuana or cannabis or nicotine or another drug. So most kids actually will. But the thing is that for most kids, it's really just trying. It's use once or twice without ongoing use. The numbers are much smaller when we look at regular users or kids who are using routinely, and certainly kids who are using daily.
Wow. Well, that's good news, right? It makes sense. This is the age where you experiment.
Developmentally, kids are built to take risks, try things, go for things that are exciting and adventurous. Nature actually made us that way. And I would say that substance use is not healthy and it's not natural, but it does fulfill a developmental drive for young people. So it shouldn't be surprising that if substances are available, we might see young people trying them. That having been said, again, that some kids will just try them and move on, and other kids will really try them and start using more frequently and more heavily. And that's where we can really get into trouble.
What are the substances adolescents or kids might be experimenting or trying?
The most common substances that teenagers will use are alcohol, cannabis, and nicotine. Use of any other substance is actually pretty uncommon and might suggest a more serious problem. The most common pattern of alcohol use by teens is heavy episodic drinking that we sometimes call binge drinking. So the National Institute of Health, the NIH, estimates that about 90% of all alcohol consumed by teenagers is as part of a binge. Adolescents are really primed to do things that are kind of exciting and extreme, right? So it's not really that surprising that this pattern of drinking is more common. But it's usually episodic, meaning it's very rare to see kids who are drinking every day. On the other hand, it's much more common for us to see kids who are using cannabis every day or multiple times a day, and the same with nicotine.
And I imagine that the physiologic effects of those different patterns and the different substances has a different impact on kids.
Every substance can actually interfere with brain growth and development.
What about the things that, I think are maybe almost easier to get, like prescription medications that might be in the home or, or from friends? Do you see a lot of use of that?
I'm glad you bring that up because there's another class of drug use that we don't always think about as drug use that's also really important. And that is that sometimes kids will use substances really for what they're intended for, but they'll be using them without prescription or advice from a physician. So, for example, we see teenagers using somebody else's ADHD medications or prescriptions just because they want to study more. And sometimes parents feel like, well, I understand why my child is doing it, and it's not the same thing as, drinking alcohol, for example. But the truth is that it's a very, very dangerous behavior, especially today, because a lot of the pills that come from, that people can get from a friend or get from social media or get over the internet will actually not be pharmaceutical products, but they'll be pressed pills that are produced illicitly, and they can be contaminated with fentanyl.
Oh,
that's really important. I know this is very scary.
Yeah.
But more than half of the kids in the teenage age range who died of an overdose were not known to be opioid users. In other words, they were somebody who just took a pill. Many of them, having no intention to take fentanyl at all.
That is so tragic. Just to make sure I'm understanding you correctly, it's almost like potentially even out of I don't know what you might think of as a good use or intention because you want to, study harder. Not that you should, but rationale in their head. But then they're actually taking substances that aren't from a pharmacy and that can be laced with other obviously very dangerous and potentially deadly substances like opioids.
That's exactly right. So we sometimes call that instrumental use. That actually ends up being a very dangerous behavior for lots of reasons, in part because all of these medications actually have some addiction potential. And so if they're not being supervised appropriately, people can develop substance use disorders. But then even more acutely, depending on where kids will get these pills, they can be laced with other substances, including fentanyl, and they can be deadly. And I talk to kids all the time in the program, and they tell me, well, I got this from a friend, and I know my friend has a prescription, and so I know this is safe. And the truth is that if you didn't fill the prescription at the pharmacy yourself, you don't really know where it's coming from. Not because your friend has any bad intentions, but if they got it from their friend, if they got access to it on a social media site, there can be real problems.
Yeah, just so many ways that it seems like almost a deadly accident can happen, without a teen even having any knowledge or awareness of the risk.
That's exactly right.
Oh, this is very scary to me as a parent of two teens.
The absolute number of teens who die from fentanyl overdose remains pretty low, right? And
that's good news.
However, there are these things that we can do, right? And so I think, the bottom line is really being sure that you're teaching your teenager not to take somebody else's medication, right?
Yeah.
I mean, because...
And talking about it, right?
And talking about it, just telling them like, look, I know that you just want to study harder, but this isn't the way to do it.
I think you're right to talk about, don't do drugs, don't drink alcohol. But now that conversation's a little bit more complicated.
And because this is not really how people often think about drug use, parents might not know how to think about it or how to talk about it.
It's really important for us as parents to know.
It also happens to be that during adolescence, our brains are actually more vulnerable to developing what we call addiction, right? And so when I say addiction, what I mean is the loss of control over substance use. And many of us are familiar with addiction, right? So many listeners probably know somebody who is addicted to nicotine, may want to quit. Of course, they can decline any individual cigarette or vape, but they have trouble quitting for good. The brain has kind of misfiled substance use as something that's really important for life, just as important as breathing or drinking water. So, cigarettes are pretty easy to get, right? And so somebody who has a nicotine addiction will find themselves smoking without even thinking about it.
Wow.
On the other hand, if it's hard to get a substance, people will adjust their behavior sometimes to get it, right? Sometimes in really dramatic ways, because they feel like they need it. And if you've spoken to somebody who has, like, for example, an opioid addiction, when they have these cravings to use opioids, they can really feel like they're dying. And they need to use opioids. And again, it's kind of like this misfiling, like the brain has just decided that use of the substance is critical for life. It's a mistake, but that's how it's encoded in there neurologically.
It's a true neurologic, need or dependency. The addiction is so much that they don't even realize it. That's I think that's an interesting way to think about it. Let's maybe take a step back. What are some of the things that we as parents need to know about how to help prevent our teens from, using substances and or getting addicted?
Kids want to do things that are exciting. They want to take risks. They want to, they want to explore, right? So, I think that the more parents can offer kids opportunities to discover what they like doing, the better.
Let's fill that need, that developmental stage, but with other things that are more positive.
Exactly.
Okay, I like that.
Exactly, right? And so, I think parents listening might be rolling their eyes because kids don't necessarily want to take up an activity that their parents suggest.
Yes, been there, done that, yes.
Yeah, so I think the key there is, making it available without pushing it. We've always encouraged our kids to play sports, and, we've suggested all kinds of, different opportunities. And my son came home a few weeks ago and said, I want to play lacrosse. The underlying idea was that, let's try out a sport. And so, maybe, so maybe he didn't go with our suggestion, but, he chose something else.
Yeah.
So, I think it's that kind of thing where you make options available and let kids find their way and pick and choose. So the more you push on a sport, perhaps the less likely they will be to take it.
Well, it's funny you say that. Our kids were doing swimming. All of a sudden decided they didn't want to do swimming anymore. And what I've done with them is to sort of figure out what is it that their friends are doing, or what are the things that they're seeing on TV, and try to lean into those. Are you interested in this? And
right, exactly. So, having a friend do something, that's always, a pathway in. Or, I've heard parents say, look, I want you to do some physical activity. So you decide what it is. There are different ways that we can encourage our kids to do that. And then, it's not necessarily going to be a sport for everybody. Sure. It could be art, or it could be theater, or it could be, there are a million different things people can choose. And I always like to point out that, some families, it's a privilege to have your afternoons free, right? And some families really need their older children to help care for their younger children, or for other family members. If kids are going to have chores, or if you need their help in the afternoon, just be sure that you're recognizing that and giving them, positive feedback, and that can be very fulfilling as well.
Yeah, no, I think you're right. I keep constantly learning this podcast as I meet with different specialty experts, and we talk about different challenges. Staying really in tune with your kids, and so that you can see what are the things that give them, sort of satisfaction or feel valued. And once you can figure that out, it's magic.
Encouraging them to figure it out, right? So you have to follow their lead.
Yes.
And, if things are working well, they will be able to tell you.
That's right. And it may change too, is what I've learned.
Oh, it will change.
Going back to our parent, Melissa, and she's been thinking about, should I allow thinking about that exposure, should I allow her to have access to alcohol at home where I can watch her? What do you recommend to parents who are also thinking about that as a preventative way to say, okay, I'm going to let this happen because it's under supervision, or, how do we create effective boundaries, I guess is what I'm asking as a parent.
It's a question that comes up a lot, so it's a great question to tackle here. So the bottom line is I always encourage parents to discourage substance use, to really let their kids know that their kids don't have their permission to use substances, right? And make it very crystal clear. Now, it turns out that this question has been studied extensively, and we know that parent disapproval of substance use actually has a big impact on kids. Kids whose parents disapprove are much less likely to report having used substances.
So the fact that I keep bringing this topic up with my kids and they now roll their eyes at me like, Mom, we already know what you're about to say, is a good thing?
I think that's how
Okay,
parenting
good.
awards are won. But I want to actually give a little nuance to this because of some research that we've done here at Boston Children's. So we asked about 5,000 kids who were in public schools across the state of Massachusetts. We asked them what their parents thought about teen alcohol use and teen cannabis use. And the question was multiple choice. So they could say that my parents disapprove, or they could say my parents approve, that my parents are pretty neutral about it, or my two parents disagree.
Wow.
And so, and then we looked, and then we kind of compared their own reports of past year substance use with what they said about their parents. And what we found was, first of all, most kids, something like 80%, told us that their parents disapproved. So
It's okay, that's good.
yeah, no, that's good, right?
They know.
Yeah, so most parents disapprove, and they're giving those signals, and the kids are picking up on them.
Yeah.
Great. Out of the rest of them, there was no difference in the rates of past year substance use between the kids who said my parents approve, and the kids who said my two parents don't agree with one another, or my parents are pretty neutral about this.
Wow.
So it's the clear message that seems to work. Wow. And these softer messages, they appear to be less effective. So that's really important, because I think that sometimes parents worry that giving a real clear message is going to sound harsh or is going to interfere with their relationship with their child. But our study says clear messages are really important to get the job done. And I would say on the level of having counseled thousands of parents, that these messages don't need to be harsh. And having given them myself to our three kids as they were growing up, they can really just be honest. When your kids are teens, they're going to come to you and they're going to ask, can I go out tonight? Can I go with this friend? Can I go to this party? Can I go here or there? There's a perfect opportunity for you to say, yeah, sure, you can do that, as long as we have an agreement that you won't use substances, right? It's a perfect opportunity. It's not harsh. I've always told my kids, like, you're not responsible for what the other kids are doing. You're only responsible for yourself. And this is my expectation of you. And that's always been a message that I've encouraged other parents to give as well.
That's really good advice. I think, and I think the point that you made too about, setting that stance has really resonated with me, because I think while I have started saying that and having the conversation with my kids pretty early on, I worried that almost like, I wondered if putting it out there, if they would, in a fit of like anger at mom kind of thing, if that would push them to use it more, because they know that I'm not for it and I don't support it and that I don't want them to do that.
The evidence says that really works. In my clinical experience, my personal experience, it doesn't make kids angry. If you can really pair that with honest conversations and answering their questions about substances, I think that, kids will grow up sort of understanding what these things are, and that, and then later, if they choose to use substances as an adult, they'll really kind of understand it.
Yeah, no, I think that's good.
I actually do want to add one more piece to this, though, because, Melissa asked a very common question of like, well, what if I supervise, right? So the kids are in my house, and I think that I'm I think that a lot of people, have this well-intentioned idea that, well, if I invite a bunch of teens over and I take away their keys, they'll be safe. But, the reality is that it's not really quite that simple. When you get a bunch of teens together at a party and you offer alcohol, you can be sure that a lot of teens will consume a lot of alcohol. And so, we see all the time kids who are at these kinds of events and ended up having blackouts or passing out, ended up in the hospital. There are terribly sad stories about kids who wander off and drown or wander off in the winter, kids who have died of exposure because they couldn't find their way back to the house. They were so impaired. Unfortunately, there's just no way that the drive to do things that are exciting and extreme is so strong that there's really no way to throw alcohol into the mix with a lot of kids and keep everybody safe. Just having a parent upstairs in the house or even in the same room isn't really going to help them, right?
So there's really no safe way to allow your kids to, consume alcohol.
That drive to do things that are so extreme, it actually diminishes over time. As they become adults and as their brain matures, if they're going to use alcohol, they will drink in a more adult pattern. The people who tend to drink heavily as adults are the people who drank heavily as kids, right? Because they've developed substance use disorders and that pattern is persistent in them.
That makes sense, yeah. So many reasons better to just hold off, share your perspective, right? Make your kids know, what your expectations are. And sounds like we got a good answer from Melissa, who is probably struggling with that difficult situation. And I think all of us have wondered that. So thinking about the long-term impact too, are there any specifics that you would think might be helpful for us as parents to know so that we can share these with our kids?
For people who've developed a substance use disorder, the way that they get pleasure is by using that substance. And other things that are supposed to naturally give pleasure, sometimes they just pale in comparison. So really what we want from our kids starting in about middle school and then through the high school years is we want them to develop motivation, interests, to have some self-drive, to find things interesting and pursue them. And unfortunately, people with substance use disorders, that actually can be replaced a little bit by substance use. Wow. And that actually has long-term outcomes that we want to avoid. Kids who develop substance use disorders, they're more likely to have problems with their memory. They're less likely to complete their education. They're less likely to start a family of their own. They're less likely to have good job satisfaction, right? And so, they have, as a group, they have worse functional outcomes. Substances can actually have direct impacts on the developing brain as well. Cannabis, that has the biggest impact. Kids who use cannabis during their high school years, kids who use heavily during their high school years, have been shown in big studies to have declines in their IQ over time. The group that didn't use cannabis, their IQ stayed about the same over the 35-year study period, and the group that was using cannabis heavily as adolescents, their IQ fell about 6 points. So 6 points is
something.
It's something. It's statistically significant. It's not something that you would be able to pick up just by talking to somebody. You actually have to use, these kinds of tests to tease that out. But it does point out to us that, there's something going on in the brain that really isn't healthy.
Yeah, and I think as parents, right, I think if we share those things, depending on the child, that it's going to resonate with them,
That's right. I don't think anybody wants to lose IQ points, right?
No.
So we can all be on the same page as that. And it's really important to remember, too, because people smoke cigarettes and they become addicted to nicotine. And I think often there's this understanding that nicotine addiction is bad because
all kinds of things that happen to your body from
exactly, and the heart disease and the cancer risk and all of that. That is true, but sometimes we forget that actually the nicotine addiction in and of itself is a harm.
Wow.
Right? And so, for the same reason that any substance use disorder is a harm, it's this problem with salience. And even if we can take away all of those terrible medical problems, the addiction itself is a problem.
something really important for parents to realize and to be able to share with their kids, as they're also having that conversation about their expectations and why it's important to not to have these substances become part of your world, so to speak, as it impacts your body in so many ways.
Absolutely.
So let's talk a little bit. We talked a lot about prevention, which is obviously the ideal. But what are some of those early warning signs that maybe we need to be looking out for so that we might be able to hopefully identify it sooner than later?
A lot of early signs of substance use are hard to detect. So what I encourage parents to do is to just kind of keep an eye out. Parents can recognize when a child's been drinking alcohol right there. Speech might be slurred. They might smell of alcohol. Cigarettes have a smell. And, smoking of cannabis will have a smell as well. Although vaping products have much less smell, so they can be harder to detect. But people who've used cannabis products might become chatty. Their eyes might be red. They might become hungry, or they might become quiet and tired. Any of those telltale signs should be followed up by a conversation. Also, I really encourage parents to keep an eye on what I think of as the public spaces in the house. So, so things like the kitchen, the bathroom. If you, if you're doing the laundry, or and you find a vape pen in the bottom of the machine, right? It was in a pocket somewhere. These are all things that we should pay attention to and really talk to your kids about. I don't encourage parents to invade a kid's privacy. I mean, I think as teens are growing up, it's really important that we give them a little space, unless we start seeing that there's a problem. When we start seeing there's a problem, we might need to monitor a little bit more. Okay.
So that's actually another question that I had. Like, should I be going in and periodically checking the drawers and under the bed and, to see if I see any signs?
This is always a very fine line and hard for parents to negotiate. But generally, if your kid is doing well and you haven't seen your child impaired, you don't have any other concerns, you haven't found anything of concern around the house, I would encourage you to let your child have a little space.
I think it supports your relationship with your child. You're not looking to invade their privacy. It's not that you don't trust them. But public spaces, or you see signs, that's when you have to have that conversation.
Exactly. So that's when you have to have that conversation. Remember that 75% of kids will try a substance before they graduate high school. So having seen it once in a kid who's otherwise doing really well doesn't necessarily indicate that there's a very severe problem, but you definitely need to have the conversation.
Yes.
And I would not have the conversation while the child is impaired, right? You want to wait a little till everybody is calm. You also don't want to have it while you're very angry or upset, right? Let everybody kind of settle down, but you don't want to wait too long, right? Describe exactly what you saw, right? Yep. And ask them what happened, right? So you can say something like, I saw that your eyes were red and that your clothes smelled like marijuana, and, you got home kind of late and went right up to your bedroom. So I'm wondering, I'm wondering what happened. You can say these are often telltale signs, so I'd like you to tell me what happened.
Exactly. And then you can learn from them what's going on, and then that can help guide that conversation.
That's true. And no matter how well a parent does this, some kids will shut down, right? Yeah, just because they're angry, or they're, I'm sorry, I don't mean angry. I mean, they're worried that they're going to get in trouble, or they're embarrassed, right? And so they just don't want to talk about it. There's only so hard you can push. I think having that conversation alerts your child that you noticed.
That's when you're doing a little bit more methodical monitoring.
Right. So, you're also giving your child the message that this is not okay. Our house rules, are don't allow substance use. Yeah. It's, if you see it again, that's when you need to start thinking about speaking to somebody, right? Like a pediatrician, or, a counselor if your child has one, and start saying, look, I've noticed this on more than one occasion. I'm concerned.
Yeah, and get some help and partnership in that.
Exactly. And even if, for example, if your child speaks with a counselor, has somebody at school or in the community, making sure they have that conversation, even if they're not willing to share all the details with you, knowing that there's a professional involved is important.
Yeah, no, that makes sense. It's good to start early getting that help.
The truth is that in the very unlikely situation where your child has only done this twice and you happen to notice both times, it's not going to hurt them to have these conversations, right?
That's true. So true. For many of us parents, knowing that, experimentation may happen. Are there things that we need to know about that might put a individual at more risk of getting to a substance abuse problem?
There are certain factors that put kids at greater risk. Substance use disorders are somewhere about 50 to 60% heritable, right? So your genes have a really big impact. Now, you can't change your genes.
Yeah.
If there is a family history of substance use disorders, there's some evidence that talking honestly to your kids about their special risk factors actually helps them in making decisions. That's one piece.
Okay.
Kids who have mental health problems like anxiety, depression, ADHD are at greater risk of developing a substance use disorder. So really making sure that the underlying problem is being well cared for, and paying attention to substance use is even more important in this group.
Okay.
And if your child is working with a counselor or somebody who's prescribing medications or a psychiatrist, whoever that person is, really telling them if you're starting to see signs of substance use, so that can be taken into account as part of the conversations that they're having.
Makes sense.
Is a really good thing to do.
I think this is really helpful too, because especially today we know with our mental health crisis that so many teens are experiencing depression, anxiety, and then or may have attention deficit hyperactivity disorder. So it's good to sort of know what those risk factors are so that we can be more aware as parents.
Remember that those things go together, right? And for a lot of kids with underlying mental health problems, substance use may be a strategy or a relief, because substances relieve problems in the moment.
Yes.
They tend to make all of these mental health disorders worse over time. But, I think of it, and a lot of people are familiar with this about opioids, so I think there's a good analogy here. So opioids treat pain in the moment, right? If you break a bone, you might be given an opioid to relieve the pain. But if you continue to take opioids, actually what happens is your body becomes more sensitive to pain over time. And so, that's the difference between the short-term impact and the long-term. And we have to think it's the same thing, that kids might use cannabis to relieve stress. It's a great stress relief in the moment, but over time, it makes anxiety disorders worse.
So that's also, I think, maybe another important conversation to have with our kids. This may make you feel better in the interim, but in the long run, it's going to make things worse.
Yeah, that's right. And make sure that, that we're not just taking substances away, that we're addressing the underlying problem as well, right? That all needs to go together.
Yes.
And, I've met plenty of kids who've said to me, look, cannabis is the only thing that makes me feel better, or, lets me sleep, or, whatever the problem is. So don't even talk to me about quitting, And so, I start with saying, let's talk about what's troubling you, and let's see if we can make some progress on that first.
Makes
right.
sense.
And then actually, as you start working on it, the substance use always comes up. Right.
Yeah.
And you can handle it. So even if it's not the first thing a kid wants to change, just getting into treatment with somebody who's, a trained professional is really, really important.
So that kind of brings us to my next question, which is, so now what if you believe that your child has a substance use disorder, right? Or that it's a problem? I guess what are, what kind of treatment options are there?
I want to start by saying that in my opinion, a pretty big majority of kids with substance use disorders can be treated in outpatient settings. Addiction, you have to think of it as a chronic disorder, right?
Yeah.
And the way we treat it is the way you treat other chronic disorders, which means over time. And it includes a combination typically of medications, education, counseling, and social support. If they're having cravings or withdrawal, there are some medications that can help with that. We want to make sure that they have education about it, just like you would with any other condition.
Yeah.
We want to offer kids counseling because substance use is often used to help manage stress or dissociate from difficult memories or help somebody when they're feeling depressed. It's often things that are, in the past that we may not even be thinking about, right?
Wow.
I mean, kids who have had a history of being bullied at school or, other problems.
So many traumas, right, that kids go through.
Exactly. People also need to learn to re-navigate their environment without substances, right? And so for adults, that's often through the use of peer counselors. For kids, it's often parents can serve that role, actually, right? It looks a little different, but often parents, can support kids in that way. There are also things like apps, websites, and text messaging services that actually have been shown in big studies to help people a little bit. So, they're free. You can just download them on your phone. And so, that's another way that people can get just a little extra support.
Yeah, and most of our adolescents are pretty comfortable using those apps and smartphones. So, hey, we can put it to really good use here.
Exactly.
That's great. Can you tell us a little bit about the addiction program here at Boston Children's and how that works?
Yeah, so the Division of Addiction Medicine here actually has 2 clinical programs. So one of them is a full-service outpatient substance use disorders program for children, adolescents, and young adults and their families.
Great.
And that program is staffed by addiction medicine specialists, child and adolescent psychiatrists, and master's level licensed social workers.
Wow.
And we work as a team, so kids come in for a fairly thorough evaluation, and then we make individualized treatment recommendations. Our services include individual counseling, group counseling, medication visits, psychiatry appointments, and parent guidance. So we put that together so that we can address all of the components of substance use treatment. It's all done outpatient, right? So kids come in for visits usually somewhere between once a month to, at the most once a week.
Okay.
Between all of the different providers that we have.
Wow.
I also would love to mention that we have a second clinical program. So one of the issues about substance use treatment is lots of people who have substance use disorders don't perceive a need for treatment and don't want to come to a substance use disorders program. And that's true across the age ranges, but it's especially true in young people.
Huh.
And so one of the things we've done is we've developed a highly collaborative program with all of the pediatric primary care providers in the state of Massachusetts. So we actually host a consultation call line where primary care providers can get, kind of doctor-to-doctor consultation on how to manage the medications we talked about.
Oh, fantastic.
And we can provide also virtual counseling through our group of counselors for kids who are getting medication support with their pediatrician, but also need that counseling piece. They want to get all the components of substance use treatment. We can do that without kids being referred to a substance use disorders program, which for some families just suits them better.
Yeah, no, that makes sense. And there probably are potentially logistical challenges of travel and things like that for some families.
A lot can be done virtually these days.
Yeah.
But, some folks just feel more comfortable, seeing their pediatrician.
Yep.
And then getting the counseling at home or in the privacy of their own space.
What advice do you have for parents who may not be in the Boston area or Massachusetts and, who may have a child who's dealing with a substance use disorder? What kinds of things should they be looking for if they're going for treatment?
Yeah, so, we have a mantra in addiction medicine, which is never worry alone, right? And so if you're worried that your kid might have a substance use problem or disorder, talk to somebody, right? So places that you can start are your child's pediatrician.
Okay.
Right? You can talk to a counselor if your child has one. Sometimes a school counselor might be available. These are all places to start.
Yeah.
And if a professional meets your child and feels they need more support, they'll help you navigate the treatment system in your area.
That makes sense, yeah. And I imagine there are other addiction programs now in other children's hospitals even because of the need that would be able to support.
So often we sometimes get emails or phone calls from folks in other states saying, can you help me? And what we do is we actually look for usually the academic addiction medicine programs in the state. And not all of them provide services for children, but they often know who does. So they can help point us in the right direction. And I think we've been pretty successful in helping people in other states find what they need.
That's incredible. Well, it's great to be at a place that can help others across the country. What's on the frontier? Where are the innovations and research going when it comes to addiction medicine?
Yeah, so research in pediatric addiction medicine is very exciting. I can tell you about a little bit of the work that we're doing here at Boston Children's. So one of the big projects that we're doing is we're recruiting a large number of teenagers who are about to undergo surgery and who will receive pain medications postoperatively to help control pain. We're following those kids for a year because we know a proportion of them are going to develop an opioid problem. And we're trying to understand what are the factors that are most associated with going on to develop an opioid problem and trying to figure out how we can interrupt that process. Right.
That's so important. Yeah, because we want to provide pain. I mean, having been someone who's had a lot of orthopedic surgeries myself and had my fair share of opioids prescribed, you really want to make sure you control pain, but you don't want to, have that happen as a consequence.
Exactly. So how can we do it and make sure that we're treating pain and also doing it in the safest way possible and preventing substance use disorders from developing later, right? So that's because the typical course doesn't happen right away, right? It happens over time. And so how can you figure out who's going to have this problem later and then interrupt it?
That's exciting.
So that's one area. And another big project we're working on is developing a vaccine that would actually protect people from fentanyl overdose if they got exposed. And so, that's a work in progress. But the idea is that the vaccine would stimulate the body to produce antibodies so that if somebody used fentanyl, the antibodies would bind to it and make the fentanyl molecule too big to cross into the brain and prevent overdose.
Wow.
And so, there's work going on to see if we are able to successfully develop a vaccine and to really try and understand who might best benefit from it.
That's really exciting because that vaccine sounds like it would be really life-saving.
Absolutely. If we can figure out who are the people who are most likely, a greater than average risk of being exposed to fentanyl, then having a vaccine for that population might be life-saving.
As we near the end, I always love to ask, there's always so many ideas that I have when I hear about the research piece, but is there anything that we haven't talked about?
What I would point out to the listeners is how important the role of parents really is, because sometimes that's underestimated, right? You can feel as your kids become teens, right?
You're losing control.
You're losing control. You suggest something and they go in a different direction, right? Because they want to be their own person and that's normal.
Yep.
And yet, what you say and what you do is so important. And you really do have a big impact on your kids.
I think that's also really good to keep in mind as a parent. And I have heard, other people say they're still listening, even if you can't tell.
That's exactly right. Even if you don't feel like it's making a difference, keep doing it anyway.
Okay, good to know. All right, I'm going to keep doing it then. Just keep having those conversations.
Exactly.
Well, now as we wrap up, it's time for Doctor's Orders. And this is the part of the episode where you share important information that parents can apply to their everyday life to help raise healthy, happy kids. So what are your Doctor's Orders today?
I want to end on a positive and encourage parents, remind them that The teen years, the brain is driven to do things that are fun, exciting, novel, unique. So help your kids find ways to fulfill that drive that are healthy and without substances.
It's really good. It's a really good prescription. Thank you for sharing that today.
My pleasure.
And thank you for being here.
Thank you for having me.
Thanks so much for listening to Boston Children's Answers Parentcast. And as always, a special thanks to our guest parent, Melissa, and our guest expert, Dr. Sharon Levy. See you next month.